Good evening, ladies and gentlemen. This is Katyayni, your host for today. I welcome all of you to yet another episode of our ongoing series of discussions on arthritis in India to mark Bone and Joint Health Awareness Month. And we would like to thank Pfizer India for helping us put this series together. And we have our esteemed panelists today with us. We have Dr. Vipul Gupta, Joint Replacement and Arthroscopy Surgeon, Shalby Orthopedic Center of Excellence, Lucknow. Good evening, Dr. Gupta. Thank you so much for joining. So you're on mute. So we also have with us Dr. Sanjeev Awasthi, who is the president of Lucknow Orthopedic Society, Consultant Orthopedic in Indira Clinic and Orthopedic Center, Lucknow. Welcome, Dr. Sanjeev. So today we would be discussing about arthritis in India and its prevalence. We have a few panelists with us who will take us through this discussion. So without further ado, I'll start with the questions. My first question to Dr. Sanjeev. So if you could tell
Yeah.
us what is arthritis, what are the different types of arthritis, and what is the prevalence?
Okay. Arthritis means arthritis word is made by two words, arthros and itis. That means inflammation of the joint. Joint is a part of the body which is created when two bone ends come in. These bone ends, they are covered by a smooth cap which is called the hyaline cartilage, and they are surrounded by joint capsule and ligaments and a lining membrane. So any disease which causes some loss of function of either cartilage or the lining membrane or the capsule, that is called arthritis. So it is a disease of the joint in layman terms. So about the type of arthritis, they are mainly, there are hundreds of types of arthritis, but we can broadly divide them into three groups. The most common is the degenerative arthritis, in which the damage to the joint because of some mechanical factor that is there. And out of it, the most common type is the osteoarthritis, which is commonly said by, uh, called as gathia by usually people. And it in India, it most commonly affects knee joint, can affect other joints also. The second major type of arthritis are the inflammatory arthritis, in which the initially the lining membrane that gets swollen, and it secretes some inflammatory substances which causes damage to the cartilage of the joint. And most common among these inflammatory arthritis is the rheumatoid arthritis. And there are other arthritis like seronegative arthritis, juvenile arthritis, septic arthritis. There are many other types also. And the third major type is the metabolic arthritis, in which there is a disturbance of the metabolism of the body, and because of that, the joints get inflamed. And the most common types of metabolic arthritis are gout and pseudo gout. So
Right.
these are the major types. As far as prevalence is concerned, a very recent study done by Agra Orthopedic Society has found, they have done it throughout the India in multiple centers, and they found that more than 28% of population over 40 years of age was affected by osteoarthritis. So that's a large number. So many
Right.
people of the middle age, they are affected by this disease. And this is much more as compared to what the global estimates are concerned, because global estimates say that about 10% of men and 18% of women are affected. But this study found about more than 28% being affected by arthritis who are more than 40 years of age.
Right.
About the rheumatoid arthritis, it affects around 1% of the population, while gout and pseudo-gout, they constitute less than 0.5% of the population. So this is the prevalence of these major types of arthritis.
Right, sir. Thank you so much for that answer. My next question to Dr. Vipul. So, what are the common symptoms of arthritis, and what are some key risk factors that are associated with?
So, arthritis, when we say about arthritis, I will say the most common thing that when we say no arthritis, Dr. Sanjeev said कि there are many type of arthritis, but अभी भी हम ज्यादातर लोग जब बोलते हैं arthritis हमारे दिमाग में आता है osteoarthritis, arthritis that come with the age. So the most common symptom of early arthritis is swelling and pain in joint. Most of the people in their 40 and 50 start feeling कि कभी कभी जोड़ों में सूजन आती है और सूजन के साथ दर्द आता है, और ये 15 दिन से लेकर 1.5 महीने तक जोड़ों में रह सकता है. कुछ लोगों को बहुत अर्ली स्टेज में जब अर्थराइटिस होती है, स्पेशली जब पेट्लोफीमोरल अर्थराइटिस है, वो हमें शुरू होती है जब हमें चलने में दर्द नहीं है, लेकिन उन लोगों को उठ के बैठने में, सीढ़ियां चढ़ने में या इंडियन टॉयलेट में जाने में दर्द होना शुरू हो जाता है. ये अर्थराइटिस के शुरुआती लक्षण है.
Risk factors that are associated.
ओके, रिस्क फैक्टर. ओके, सो रिस्क फैक्टर, देखिए कुछ रिस्क फैक्टर जो हमारे हाथ में नहीं है, उनके बारे में ना बात करके मैं भी सिर्फ एक बात कहूंगा, जो हमारे हाथ में है वो सिर्फ इतना है कि हम अपना वजन कम रखें. Weight is and obesity is a big factor in development of and progression of osteoarthritis. Secondly, exercise. Daily exercise is a very important aspect of life that we should adopt, because if it is just simple walk 30-40 minutes a day, it actually you make your bones strong, keep your muscle healthy, keep your muscle strong, and this is a thing that you can do. Avoid alcohol, avoid smoking, that has a negative impact on your joint health. So these are the small things among the risk factors that you can actually you can control. Apart from that, the female especially are more at risk of osteoarthritis. So we have found that if I see 5 female with a undergoing knife for a knee arthritis, there are hardly 1 male that go under a knife. So you can say for every 1 male, the 5 female undergo knife. 1:5 is a big ratio. The female are more affected by arthritis. And now second is obesity. Third, you should do exercises to control your weight and increase the bone health and muscle health, and keep control on habits like smoking as well as drinking.
So, is there any specific reason why women are more susceptible or more prone to develop arthritis?
Well, we can complain to God for that, for this kind of bias. But yes, the female are more susceptible to arthritis.
Right. All right, so thank you. My next question is to Dr. Sanjeev. So, if you could take us through how can early diagnosis impact the overall treatment outcomes for individuals with arthritis?
Sorry, I'd
So,
like you to repeat.
so how does early diagnosis impact the overall treatment outcomes for individuals with arthritis?
Yes. Like any other disease, if arthritis is present in a patient for a long time, it causes some permanent damage to the joints. The bone ends, as I earlier said, that they are covered by a very special type of cap that is called hyaline cartilage. And this hyaline cartilage has got some very unique qualities, that it is very smooth and it's a great shock absorber. So once arthritis is there for a long time, this hyaline cartilage that gets damaged, and though the body tries to repair it, but the replacement is by fibrocartilage, and which is not a very great quality of cartilage. So it is not that good in shock absorption. It is not that smooth, and so the permanent damages to the joint, they happen if the arthritis is not diagnosed and treated early. On the other hand, if patient approaches a doctor in time and he is diagnosed properly, his treatment is started early, then these permanent damages can be very well prevented. Though we don't claim that arthritis can be cured, but it can very well be controlled, and the long-term sequelae, long-term complications, they can be prevented. So early diagnosis is the key to a good outcome of the arthritis treatment.
Right. So thank you so much for that answer. Dr. Vipul, following up on Dr. Sanjeev said that we cannot necessarily cure arthritis, but we can manage it. So if you could share some effective strategies for managing arthritis, including both medical and lifestyle approaches. So you're on mute.
Okay.
Yeah.
Now I'm audible. Okay.
Yes, yes.
तो जब तक आपके घुटनों में कोई दर्द नहीं है, कोई दिक्कत नहीं है, तब तक आप मतलब बस एक ही चीज कर सकते हैं जो मैंने पहले भी बोला, अपना वजन कम करें और डेली कोई एक्सरसाइज करें. सेकेंडली, व्हेन यू स्टार्ट हैविंग पेन, देयर आर फ्यू थिंग्स दैट यू शुड नॉट बी डूइंग, जैसे जमीन पर नीचे बैठना, इंडियन टॉयलेट, और जहां तक वो है स्टेयर्स को आपको अवॉइड करना चाहिए. दीज ऑल हाई फ्लेक्शन एक्टिविटी actually increase the progression of your arthritis. That's one thing that you can do in your lifestyle modification. Secondly, arthritis बहुत ही लीनियर डिसीज नहीं है. ऐसा नहीं है कि आपको एक बार arthritis हो गई तो आपको जिंदगी भर दर्द रहेगा. जब भी आपको arthritis स्पेशली इनिशियल फेज में होगी, आपको दर्द आएगा, कुछ दिन रहेगा, फिर वो ठीक हो जाएगा, फिर दर्द आएगा, फिर कुछ दिन रहेगा, फिर कुछ दिन ठीक हो जाएगा. तो जब आपको जो फेजेस हैं, जब आपको पेन और स्वेलिंग घुटने में बनी हुई है, उस दौरान आपको किसी ऑर्थोपेडिशियन को दिखाना चाहिए. रेस्ट कीजिए, कुछ दिन दवाइयां लीजिए, फिजियोथेरेपिस्ट की हेल्प लीजिए. दीज आर द स्मॉल थिंग दैट यू कैन डू इन अ इनिशियल फेज. एंड it is sometime I will say people ki nobody can tell ki when your early arthritis will change into late arthritis. It's very common analogy is graying of hair. कुछ लोगों के बाल बहुत जल्दी सफेद होते हैं, कुछ के 60-70 तक भी सफेद नहीं होते हैं. ऐसे ही अर्थराइटिस किसी को 50 पे आती है, किसी को 60 पे आती है, और हमारे आसपास कई ऐसे लोग होंगे जो 80 की उम्र में भी एकदम देव घुटने के साथ आराम से घूम रहे होंगे. तो देयर आर वेरी फ्यू थिंग्स दैट वी कैन डू to check the progression of arthritis.
My next question is Dr. Sanjeev. So, are there any reasons or arthritis that you would like to recommend to our viewers and patients?
I just couldn't get it.
So, are there any recent advancement or innovative treatments in arthritis that you'd like to tell us about?
Yes, definitely. Recently, the advancement have come, and we can divide these advancement among two major groups. One is about the medicines, medical part, and other is the surgical part. So for medicine, we have newer medicines to control arthritis, which are more effective. They cause less side effects. Among non-steroidal anti-inflammatory agents, which are the cornerstone of the treatment, we have new drugs which have caused less GI irritation, which cause less cardiovascular problems, and they are more effective in reducing the inflammation and by default reducing the pain. So we have better drugs for apart from that. Among the disease modifying drugs, we have now better drugs for rheumatoid arthritis, we have better drugs for ankylosing spondylitis, we have better drugs for osteoarthritis, which help in not only alleviating the symptoms, but also they reduce the severity of the disease and they prevent the late complications. And then we recently have started using platelet-rich plasma. So for that, patient's blood is taken and plasma with a lot of platelets, they are separated and they are injected in the joint. And that results in good relief of pain and inflammation in many patients. And another treatment which is in the pipeline, though not very established yet, is stem cell therapy for arthritis, in which stem cells are injected in the joint and they repair permanently the damage caused by it. But that is still in the innovative stage and not fully established. In some in other countries, they are cartilage transplant is also being tried to replace that damaged cartilage. And the major changes, the innovations that have come, they are in the field of surgery. The joint replacement initially was the main treatment, but now they are joint preservation surgeries, which work by correcting the malalignment of the joint, and by that they reduce the pressure on different compartments, and that prolongs the life of the joint and reduces the symptoms and prevents the further damage. And then among the joint replacement, we now have unicondylar joint replacement, in which only a part of the joint is replaced. In total joint replacement, there are many new implants, many new materials which are more long lasting. Initially, it was supposed that joint replacement is done after 10 years, you will have to get it revised. Now with newer implants, with newer substances being used, newer materials, the lifetime has increased. With improved designing, range of movement of the joint replacement has improved. So, and it's an ever-changing field. New innovations are coming, and I think in next 10 years, things will be much better.
Right, sir. Thank you so much. Dr. Vipul, my next question to you. So, could you discuss the support resources that are available to help individuals with arthritis lead fulfilling lives?
Ma'am, can you please repeat the question? Please repeat the question, sir.
Yeah, sure. Could you discuss
Can you
the
repeat the question?
support? Yes, sir. Could you discuss the support systems and resources that are available to help individuals with arthritis lead fulfilling lives?
Oh, so the support system, say, for early arthritis, like I said, Dr. Sanjeev also said that acid and everything is a cornerstone of treatment. They have been there for long. We have been treating patients in early arthritis, and other support system like splints have been there. But these all work in early arthritis only. For the treatment of late arthritis, especially the one where you actually have no joint space, is still the cornerstone of the everything. That, as Dr. Sanjeev say, now we have surgery which actually treat the malalignment in terms of STO or a unicondylar or a total knee. The kind of treatment that we are doing can be the source of debate, but the cornerstone of our advanced arthritis is still a total knee replacement. So that is the main thing that we are doing in advanced arthritis. And the thing is, as Dr. Sanjeev said, that now there is a lot of latest development in terms of design and in terms of material of implant and everything. So with that, yes, the patients are leading much normal life after the replacement, and they are actually living that normal. Like even the people surrounding them don't even know that they have underwent a surgery. So that's good. The treatment now is for arthritis.
Right. Thank you so much. Dr. Sanjeev, what are some notable regional variations in arthritis prevalence in India, and how do they impact the healthcare delivery overall?
Uh,
Variations.
the regional variations are mainly seen in, there have not been many studies done about the demographic presentation of arthritis in India, but some studies have been done about osteoarthritis, and it has been seen that the incidence of osteoarthritis is initially it was found that Rajasthan was the state where maximum number of incidence of arthritis was seen, but recently Goa has overtaken Rajasthan. So now Goa has the highest incidence of osteoarthritis in India, and Rajasthan is second, and Punjab and Kerala are third and fourth. On the other hand, Bihar is the state which has the least number of incidence of arthritis. Right. And they are before them are Madhya Pradesh and Uttar Pradesh and Jharkhand. Right. So loosely we can say that, as we know, that osteoarthritis is said to be a disease of modern living. So more affluent states, states having larger cities, states having more urban lifestyle, they are experiencing more incidence of osteoarthritis. It is influenced by daily habits, like we see that in cities, incidence of arthritis much more as compared to the villages. The village, the people, they squat, they sit on the ground for having food, they sit on the ground with cross leg, they squat frequently. So this habit from the very beginning helps in less incidence of osteoarthritis. But I would like to put a warning here that once you get an osteoarthritis, then these should be avoided. But these are not the treatment for osteoarthritis. Once you get osteoarthritis, you should avoid squatting or sitting on ground. But if you do these activities from the childhood, then the chances of getting knee arthritis and or more so about hip arthritis is low. Right. So then the very important factor about that we all know that all the current treatments of arthritis, they are quite costly, because whenever new treatment comes, it has a cost attached to it in its development. Right. So current treatment, current drugs, they are quite costly, and naturally the socioeconomic group which is not that affording, it's difficult to provide treatment to them. If you want to use biologicals in a patient of rheumatoid arthritis, and that involves an expense of thousands of rupees per month, then we cannot expect to offer this treatment to a villager who is very limited income. And unfortunately, the health insurance sector in our country is also very lagging behind this field, that they refuse to pay for certain drugs, saying that these are not covered. Right. So if a patient of a high socioeconomic group gets affected, then they have got many choices, many medicines, many options of surgery available. But for lower socioeconomic group, things are much more difficult.
Right. Right. So adding up to, following up on what you were saying about, cost and expenses. So apart from this, what are some other challenges or barriers that exist in terms of providing quality arthritis care? If you could also.
I feel that the biggest challenge for we doctors to provide good treatment is acceptance by the patient. Right. Because as soon as you tell a patient that you are suffering from osteoarthritis or rheumatoid arthritis or psoriatic arthritis, and honestly speaking, we don't have a cure for this disease, and we can help you in living a good life, we can help you in controlling the disease, we can help you in preventing late damages, but you might need to continue with certain precautions throughout your life. You will certainly need some regular exercises throughout your life, and you might need to continue some medicines throughout your life. And the patient gets depressed. He says that maybe I should go for other avenues, and then they usually fall in prey to those therapies which promise magical cure. ये 3 महीने में ठीक कर देंगे, 3 महीने दवाई खाइए. And then these patients, they come back to us after a year, after 2 years, after 5 years, saying that we were doing this therapy and then therapy, and they promise that we will get cured. And then when they'll end up with us, they have got permanent deformities, and some they are amenable to surgeries, but some joints still we don't have good replacement options. So in this case, the biggest challenge to us is acceptance by the patient. If the patient starts accepting what it has and then tries to fight it out, then things becomes much easier.
Right. Right, sir. Thank you so much for that answer. Dr. Vipul, how can health providers like you and communities work together to improve arthritis care at the district level?
Uh, as Dr. Sanjeev said, the biggest challenge in the treatment of arthritis is actually the awareness. And there are a lot of myth about arthritis that is prevalent in a rural area. There's one thing which I'll say otherwise, as Dr. Sanjeev said, रूरल एरिया में अर्थराइटिस कम होता है ऐसा नहीं है. बस क्या है कि वहां पर लोगों का हेल्थ केयर असेस नहीं है, और वहां पे एक उम्र के बाद घुटनों के दर्द को वो मान लेते हैं कि वो तो होता ही है, तो वो दे डोंट कम फॉरवर्ड फॉर द ट्रीटमेंट. सो दिस कैन बी अ रीजन कि हमें जो अर्थराइटिस पेशेंट है वो अर्बन एरिया से ज्यादा मिलते हैं और रूरल एरिया से कम मिलते हैं. दूसरा, एज यू से कि डिस्ट्रिक्ट लेवल पे हम क्या कर सकते हैं. बेसिकली डिस्ट्रिक्ट लेवल पे अर्थराइटिस के ट्रीटमेंट के लिए जो सबसे इम्पोर्टेंट, डिस्ट्रिक्ट लेवल पे सबसे ज्यादा पेशेंट हमारे जो है वो गांव से आते हैं. एंड आई माई सेल्फ बिलोंग फ्रॉम अ रूरल एरिया. आई वाज born and brought up to 12th from a very small place. आई नो स्टिल सबसे बड़ी प्रॉब्लम जो है वो है अर्थराइटिस के बारे में पता ना होना. आप गांव में जाइए, वो आपको बताएंगे कि अरे एक उम्र के बाद तो सबके घुटने खराब होते ही हैं और उसके बाद कोई दिक्कत नहीं है, थोड़ा बहुत दर्द है कोई बात नहीं, कोई सी भी दवा खा लो और डॉक्टर को दिखाओगे तो वो घुटने काट देगा. सो देयर आर वेरी मिसकंसेप्शन बिकॉज ऑफ विच जिनको भी घुटनों में दर्द होता है या किसी को भी अर्थराइटिस होती है, चाहे घुटना हो, कूला हो, किसी भी तरह की, वो मतलब डॉक्टर को दिखाना ही नहीं चाहते. ये एक बहुत बड़ी चीज है. तो व्हाट द बेस्ट थिंग दैट वी कैन डू, वी कैन एक्चुअली increase the awareness, and that should start from the very grassroots level. We should be able to teach people that it is not a thing जो कि ठीक नहीं हो सकती. ये कोई ऐसी चीज नहीं है जो आप कभी इससे बाहर नहीं आ सकते. या जिन लोगों की मोबिलिटी बहुत ज्यादा कम है उनको, या जिनको जैसे मैंने कहा जिनको सीवियर अर्थराइटिस है, उनके लिए कि वो सर्जरी से बहुत डरते हैं कि नहीं सर्जरी नहीं कराएंगे चाहे कुछ भी हो जाए. इवन इफ दे आर फाइनेंशियली सिक्योर, दे आर एबल टू अफोर्ड. और जैसे आजकल तो आयुष्मान कार्ड है कई लोगों के पास, इवन आयुष्मान में भी वो सर्जरी नहीं कराना चाहेंगे. वो कहेंगे नहीं, घुटनों के लिए हमें कोई इलाज नहीं कराना है क्योंकि इसके करने के बाद कोई चलता नहीं है. तो आई थिंक मेन थिंग एंड मेन आवर एम एट डिस्ट्रिक्ट लेवल should be first to educate people about the arthritis, about that it is possible to live healthy, it is possible to walk again, it is possible to move again, and that is very important at the district level at present.
Right. Very rightly said, Dr. Vipul. So following up on that, Dr. Sanjeev, are there any successful case studies or initiatives that you've come across that have made a positive impact in specific regions or districts? Dr. Sanjeev?
I'm sorry, I don't have any access to such case studies where any particular effect has been found about this. I would like to request Dr. Vipul whether he has any such insights.
Dr. Vipul, anything?
No, I also don't have any any study, anything which has created some kind of impact over the arthritis treatment or awareness.
I would say that unfortunately, arthritis is it is neglected in the sense that it is a very prevalent disease. But if you see that for hemophilia, there are support groups. For
Right.
cancer, there are support groups. For even for rheumatological disease like scleroderma or for ankylosing spondylitis, they are support groups. So for arthritis, we don't find any support groups, and that is a big challenge for the doctors as well the patients, that you
Right.
don't the patients don't have that much type of support where they can interact with people who are suffering from the same problem that they are. And
Right.
if some non-government organization starts working towards this and involves doctors as well as the physical therapist, some social
Right.
workers, and a very important factor would be involving those who are involved in the mental health issues, because patients
Right.
who are chronically ill, they have some mental health issues also. So these support groups should be formed, and they can help a lot in creating awareness to the patient and solving their day-to-day problems,
Right.
giving answer to their queries. And if we found that some patient is on default of the treatment, they can talk to them and bring them back to the proper treatment. But
Right.
unfortunately, arthritis is devoid of this type of support system, and that is why probably both of us don't have any access to any such studies uh,
Right, sir.
where we can found that it has made a significant impact.
We hope, sir, initiatives like ours, this panel discussion, this series of panel discussions that we are hosting helps, contribute to creating some kind of awareness for arthritis. Um, so my next question to Dr. Vipul, sir, how does arthritis affect vulnerable populations, such as the elderly, or those who have limited access to healthcare resources?
Well, what I have seen, as I say in starting की महिलाओं को अर्थराइटिस मेल से ज्यादा होती है
Right.
और एक बड़ा ही सोशल और इकोनॉमिकल एस्पेक्ट है कि हमारे यहाँ एक एवरेज हाउस होल्ड स्पेशली इवन आई कैन थिंक मीडियम एक मिडिल इनकम ग्रुप क्लास फीमेल की हेल्थ सबसे ज्यादा इग्नोर होती है, चाहे हमारी मदर्स हो चाहे वो कोई हो। हमने हमेशा ही देखा है कि अगर उनको कोई छोटी मोटी परेशानी भी होगी तो वो अपना इलाज कराना नहीं चाहती, वो कहती है नहीं मेरे को कोई दिक्कत नहीं है। और ये कहीं ना कहीं एक मेंटालिटी है जो कंटिन्यू रहती है और उम्र के साथ जब वो और एज में जाते हैं और धीमे धीमे अर्थराइटिस की वजह से उनकी मोबिलिटी कम होने लगती है, दे स्टॉप लिविंग लाइफ। एंड आई हैव सीन पीपल, आई हैव सीन पेशेंट, फीमेल पेशेंट जो जिनकी मोबिलिटी धीमे धीमे इतनी कम हो गई कि वो घर में चलना बंद कर दिया और उनको वॉशरूम जाने से भी डर लग रहा है। फाइनली वो पानी पीना कम कर देते हैं, दे गेट फ्रीक्वेंट यूटीआई एंड एवरीथिंग। सो this is very very difficult situation when there is an old person in a house who has who are who is immobile kind of thing or have very less mobility and do not want to get treatment, or they do not even want to tell their children that they are sick. uh, Unfortunately it happened quite a lot than we imagine. A lot of time, even when the kids bring those patients to the OPDs, the patient doesn't want to get treated कि नहीं बच्चे तो ऐसे ही परेशान हो रहे हैं और मैं तो ठीक हूँ, मैं बढ़िया हूँ और मैं सब कुछ करती हूँ, सब कुछ चलती हूँ। It need a lot of effort from everyone, like from healthcare, from us or paramedics, physiotherapists, and even on the part of family to tell them कि नहीं ये एक दिक्कत है जो ठीक हो सकती है और आपको इसके लिए इलाज लेना चाहिए। So again, it's difficult, but it's a common problem. I think Dr. Sanjeev must have seen a lot of patients in the same situation I'm saying.
Right. Dr. Sanjeev, if you'd like to add something, you're on mute, sir.
Yeah, I agree with Dr. Vipul that females of our family, they are neglected lot, so they are the vulnerable population. Secondly, the elderly who have retired and now leading comparatively sedentary lives, and they are usually neglected by the family with the concept that with age, joint pains has to come, and they need not be treated. So the elderly is the second population, and the third vulnerable population is that of kids, because there are some arthritis, juvenile rheumatoid arthritis, like arthritis, which affect the kids.
Right.
And there is a denial in the family that बच्चे हैं, इनको क्या है, चोट वोट लग गई होगी, ठीक है, ठीक हो जाएंगे. And when they repeatedly get joint pain and swelling, and when the doctor tells them that they are suffering for arthritis, and it's difficult to accept that इतने छोटे बच्चे को arthritis कैसे हो गई. So but they are the most important to be treated very early, because if they get joint damage at that early in the age, so not only their joints are damaged, their growth is also affected. So these are the vulnerable population, and they can be, they should be treated with the utmost care, and they should not be neglected.
Right, sir. Thank you so much for that answer. So, what are some preventive measures that individuals can take in order to, prevent developing arthritis and reduce their risk of developing arthritis?
Preventive measures are concerned, that the most important thing is that what Vipul said repeatedly is that we have to control our weight. Controlling the weight is the keystone about which the treatment and prevention and lifestyle modification of arthritis goes. Second thing is to have a very active life. Activity is enemy of arthritis. So activity which is moderate, any type of activity, walking, cycling, swimming, or any other physical exercise, that is very important to prevent the accident. And third is to have a healthy diet. We know that there are certain foods there which are anti-inflammatory, and they should be added to our diet, like the green leafy vegetables, fruits, nuts, haldi, and then dairy products which are rich in calcium. They should be added on a regular diet. And if a person is a non-vegetarian, then fish and egg, they are a very good source of vitamin D.
Right.
So these are the things that a person can do. And one more thing that is very important in our social milieu is to understanding the limit of your activity. When we say that patient should be active,
Right.
a person should be active, then sometimes this is taken too much seriously, and some people come to me and say that I daily walk for 12 kilometers a day and still I'm having knee pain, my knee pain is not going.
Right.
So too much activity is also a problem. So we should know the limits, and the activity should be in that limit. One more important factor would be exposure to sun, because in our modern lifestyle there is very little exposure to sun.
Right.
We sleep in an air-conditioned room, and then we get up and sit in an air-conditioned car and go to air-conditioned office, work there and come back,
Right.
and there hardly any exposure to sun. And sun is the most important factor to naturally build vitamin D in your body. So exposure to sun is very important. And the last thing that I would say is to limit the use of such food which are not good for your body, like red meat, fatty foods. Alcohol is not good for your joints, and smoking, tobacco is not good for any part of your body. To avoiding these things, definitely, these are the steps that a person can do
Right.
to prevent arthritis.
Right, sir. Thank you so much. That was a very elaborative answer. Uh, my question next is to Dr. Vipul. Dr. Vipul, are there any technological advancements or digital tools that are proving beneficial in the management and treatment of arthritis? I think he's having some network issues. Dr. Sanjeev, you could take that question up. Any technological advancements or digital tools that are proving beneficial in the management of arthritis?
I'm not sure about this thing, because the normal digital tools that the internet is a very good medium to get knowledge about all the problems that we have, and we if you use intelligently, that is very good. Then the social media is another factor which
Right.
helps in spreading awareness about it. And I'm not very sure about any other particular digital tools that can be
Right, sir.
beneficial.
Sir, my next question would be, how can individuals with arthritis become advocates for themselves and their communities? People who are suffering with arthritis or have dealt with it and, won over it in some way. How can they become advocates for themselves and the community as a whole?
Uh, Patients who understand the disease, they who have accepted that they are suffering from this disease, they are undergoing treatment. Then when they meet others, those who are freshly been diagnosed with arthritis, they can give good counseling to them, because a counseling given by a doctor, a counseling given by a physical therapist, a counseling given by a social counselor may not be that effective. If someone from your peer is advising you, then that message goes more strongly. So they
Right.
can tell other people that, look, if you control the disease well, if you undergo treatment properly, if you have a healthy lifestyle, and they can also advise about the assistive devices that they might be using, because there are certain assistive devices which help in giving good life to the patients, like you can use a walking stick, you can use a walker. There are some shoe inserts which help in preventing pain. Then using a kneecap or an ankle support, things like that. So if a person is using them and getting benefited, they can advise them, and such patients can also build up the communities of the people uh, who are suffering from arthritis. In that case, if they are leaders to become leaders to form such communities, and they can later be converted into very good support groups for the people with arthritis.
Yes, sir. Very rightly said, sir. I think when people hear it from the patient himself, then they tend to have a better, belief
Yeah,
that
definitely.
they can be cured too.
From the
Right.
horse's mouth.
Yes, yes. So, sir, just wanted to have some parting remarks since we've lost the other two doctors due to some network issues. So, if you could just, leave us with some parting remarks, some message that you'd like to give to our viewers.
Uh, my message is that whenever you are having joint pains, If any pain is lasting for more than any joint pain lasting for more than 2 weeks, it needs a specialist consult. So don't once you are having a consult, then have faith in your doctor. Whatever he is saying, it is for your benefit. People should also have uh, such psychological support. They should develop psychological support for themselves, which can prevent depression, and which can elevate their mood. They should use things like that, and they should communicate with others so that they don't get depressed because of their condition. And apart from the medical treatment, planning an exercise regimen is very important. Physical activity, which is a moderate activity, which is going to help you and is not causing excessive strain on joints, that should be planned in collaboration with a physical therapist. And whatever drugs are advised to you, they should be taken. If you are having any problem with any drugs, you are having side effects, then you should consult back to your doctor and inform him that you are having this problem, and that can be sorted out. So running away from the problem is not a solution. And with a little intelligence, with a little effort, these problems, they can be very well contained. And it is assured that except for a very small minority of the patients, most of the arthritis patients, they are going to live a very comfortable life, which may not be 100% one, but certainly it is more than 90% activities that they can do.
Right.
That is right.
Thank you so much, Dr. Sanjeev. I would also thank Dr. Vipul for this wonderful and insightful session that we've had. Thank you so much, Dr. Sanjeev, for joining us today, and it was great interacting with you. I'm sure our viewers have learned a lot, and they'll take away a lot of pointers for themselves. Thank you so much.